Now we will see the ulnar nerve, its roots and its codes and its branches. So as you know that ulnar nerve is coming from the medial cord, isn't it? So normally the brachial flexus C5, C6, C5, C6, C7 again, yes, C5, C6 to form upper trunk, C7 unites to form the middle trunk, C8 and T1 form the lower trunk. Okay, and all these divided into posterior and the anterior branches, all posterior divisions to form posterior cord, and the anterior division of the upper trunk and the anterior division of the middle trunk forms the lateral cord, and the anterior division of the lower trunk forms the medial cord. So this medial cord is giving branches. Out of 5 branches, ulnar nerve is the major branch. Okay, in this also lateral root of median nerve and the medial root of median nerve unites to form the median nerve, and there is some. So the root value of the ulnar nerve is mainly C8 and T1. Sometimes some branches which are coming from C7 is also associated with the ulnar nerve. Okay, so this is the course root value C8 and T1, how the ulnar nerve is formed. Ulnar nerve is the main branch of medial cord. Okay, now in the axilla, so in the axilla it lies medial to the axillary artery, and it is also lies medial to the brachial artery in the arm. At the middle of the arm, it pierces the intermuscular septum. Normally we are having this intermuscular septum, lateral intermuscular septum and medial intermuscular septum. At the middle of the arm, this ulnar artery pierces the medial intermuscular septum and comes to the posterior aspect. So, and in the posterior aspect, it lies in between the medial intermuscular septum as well as the medial head of the triceps on the posterior aspect. Here comes the arcade of Struthers. So there is an thin aponeurotic connection which is connecting the medial intermuscular septum to the medial head of the triceps. So on the posterior aspect, through the arcade of Struthers, this ulnar nerve passes along with the ulnar collateral artery, which comes to the posterior aspect of the medial epicondyle. You can see. So this is the epicondyle. It comes posterior to the medial epicondyle. So now in the arm, this ulnar nerve lies medial to the brachial artery, and at middle of the arm it pierces the intermuscular septum, medial intermuscular septum, and comes to the posterior aspect and passes through the arcade of Struthers along with the ulnar collateral artery and descends. This arcade of Struthers is present about 8 centimeters proximal to the medial epicondyle on the posterior aspect. Okay, So after descending down behind the medial epicondyle, so here another fibrous sheath is present called as cubital tunnel. Through this cubital tunnel, this ulnar nerve this ulnar nerve comes out of this cubital tunnel and comes into the forearm, and it comes into the forearm by passing deep to the tendinous arch, that is nothing but the uh, this cubital tunnel, deep to this arch, which is joining the humeral and ulnar heads of the flexor carpi ulnaris. Here flexor carpi ulnaris is taking origin from the humerus as well as the olecranian process, which is present on the posterior aspect. So ulnar head and the um, humeral head. So the nerve is passing deep to the humeral and ulnar heads of flexor carpi ulnaris, and it then runs down the medial side of the front of the forearm. It runs medial side of the front of the forearm, lying superficial to the flexor digitorum profundus. Lying superficial to the flexor digitorum profundus. This flexor digitorum profundus is the deep flexor muscle. So below the flexor digitorum superficialis, this flexor digitorum profundus muscle is present. So this nerve is lying superficial to the flexor digitorum profundus on the medial side of the front of the forearm. Okay. In the lower two-thirds of the forearm, the nerve is accompanied by the ulnar artery. So this one is the ulnar artery actually. Okay, ulnar artery. So this nerve is accompanied by the ulnar artery, which lies lateral to the ulnar nerve. So this is the lateral side. This nerve is accompanied in the lower two-thirds of the forearm. In the lower two-thirds of the forearm, it is accompanied with the ulnar artery, which lies lateral to the ulnar nerve. Okay, in the upper part of the forearm, the nerve is deep to the flexor carpi ulnaris and to the flexor digitorum superficialis, isn't it? So flexor carpi ulnaris is also a superficial muscle, and flexor digitorum superficialis is also a superficial muscle. So this nerve in the upper part of the forearm, which lies deep to these muscles and superficial to the flexor digitorum profundus. Okay, here we can say these are the relationships of this nerve. Okay, in the upper arm and the lower arm. Okay, and it becoming superficial in the lower one third. So the nerve becoming superficial in the lower one third. So what happens in the lower one third? So it lies between the tendons of flexor carpi ulnaris medially, and tendon of flexor digitorum superficialis laterally. So the median nerve lies in between the two tendons. One is the flexor carpi ulnaris on the lateral side, and flexor digitorum superficialis tendon on the lateral side and flexor carpi ulnaris on the medial side. Okay, now here the nerve enters the hand. The nerve enters the hand by passing superficial to the flexor retinaculum through the ulnar canal. So above the flexor retinaculum, the ulnar nerve passes through this ulnar carpal ligament, or also called as ulnar tunnel. Okay, after passing this ulnar tunnel, and a groove is also present on the lateral aspect of the pisiform, that is called as Goyen's canal or Piso-Hammett canal here. After passing through this canal, the nerve is divided into superficial branch and the deep branches. Superficial branch and the deep branches here. Okay. Now, the ulnar nerve is distributed to skin, muscle and joints through its various branches. Okay, so this is about the course of the ulnar nerve. This is the course of the ulnar nerve. So, the superficial branch terminates as a digital branches, lateral 1.5 digital branches, whereas the deep branch supplies to the maximum intrinsic muscles of the hand. So this ulnar nerve is also called as musician's nerve. Ulnar nerve is also called as musician's nerve because maximum number of intrinsic muscles are supplied by this ulnar nerve. So ulnar nerve is also called as musician's nerve. Now we will see the branches of this ulnar nerve. Yes, in the arm, the ulnar nerve doesn't give any branches in the arm. It gives branches in the forearm as well as in the palm. Okay, in the forearm, it gives out muscular branches, articular branches, as well as the cutaneous branches. So, the articular branch is arising as the nerve passes behind the medial epicondyle and gets distributed to the posterior aspect of the elbow joint. So, whenever this nerve is passing on the posterior aspect of the medial epicondyle, it gives a branch to the posterior aspect of the elbow joint. Okay. And when it piercing this flexor carpi ulnaris, isn't it? It is passing in between the two heads of the flexor carpi ulnaris. Then it gives two branches to the flexor carpi ulnaris and one to the medial part of the flexor digitorum profundus. So it is giving two muscular branches after entering into the forearm. One branch to the flexor carpi ulnaris and another branch to the flexor digitorum profundus. So this nerve is passing in between the two heads of flexor carpi ulnaris and then it runs down to the medial side of the front of the forearm and which is superficial to the flexor digitorum profundus. At that time it gives two branches, one branch to the flexor carpi ulnaris and another branch to the flexor digitorum profundus. Okay, so these are the muscular branches and articular branches in the forearm. And also in the forearm it gives two cutaneous branches. One is the palmar cutaneous branch and another branch is the dorsal cutaneous branch. The palmar cutaneous branch arises near the middle of the forearm, piercing the deep fascia. It pierces the deep fascia in the distal forearm and becoming superficial. So it is arising at the middle of the forearm and it piercing the deep fascia of the forearm and becoming superficial. It passes to the medial side of the palm. It passes to the medial side of the palm and supplies the skin of the area. So the palmar cutaneous branch of ulnar nerve supplies to the medial side of the palm and supplies the skin of that area. Okay. So this is about the palmar cutaneous branch. And coming to the dorsal cutaneous branch. Dorsal cutaneous branch is the larger of the two cutaneous branches, which is arising from the ulnar nerve a little above the wrist joint, It runs downwards and backwards. Under the cover of flexor carpi ulnaris, and becomes cutaneous in the distal fourth of the forearm. Okay. It then winds the medial side of the wrist. To reach the dorsum of the hand. After giving out cutaneous branches to the wrist and back of the hand, it terminates in 3 dorsal digital branches. So on the dorsal side also it is giving 3 digital branches. The most medial branch runs along the medial border of the little finger till the root of the nail. Okay, the next branch divides into 2 and which supplies to the lateral aspect of the little finger and the medial aspect of the ring finger on the dorsal side of the hand Again we will see the dorsal cutaneous branch. The dorsal cutaneous branch is larger of the 2 cutaneous branches, arises from the ulnar nerve a little above the wrist under the cover of flexor carpi ulnaris. We know that flexor carpi ulnaris is present on the medial aspect, isn't it? Under the cover of flexor carpi ulnaris and becomes cutaneous in the distal fourth of the forearm. Okay, it then winds around the medial side of the wrist. To reach the dorsum of the hand. This is the palmar aspect. It reaches the dorsal side of the hand. Okay. So after giving out some cutaneous branches at the wrist, it terminates in 3 dorsal digital branches. One branch is for the medial side of the little finger till up to the root of the nail, and another branch divides into 2 slips for lateral side of the little finger and the medial side of the ring finger, same as in the dorsal palmar aspect also. Okay, this is about the dorsal cutaneous branch of the ulnar nerve. Okay, and here after it is giving the cutaneous branches in the forearm, so the nerve supply in the forearm is over here. So in the forearm it gives some articular branches to the elbow joint on the posterior aspect, and it is giving two muscular branches, one for flexor carpi ulnaris and flexor digitorum profundus, and two cutaneous branches, one is the palmar cutaneous branch and the dorsal cutaneous branch. So these two supply the skin. The palmar cutaneous branch lies deeply and it pierces the deep fascia and comes superficially, and which supplies the medial side of the palm and the skin over it. But as the dorsal cutaneous branch, which is arising above the level of the uh, wrist, and it runs downwards and backwards, and it winds the medial side of the wrist and entering into the dorsal side of the hand, where it supplies the 1.5 fingers by giving 3 digital branches. So one medial branch to the medial side of the little finger, another branch again divided into two digital branches with supplying the lateral side of the little finger and the medial side of the ring finger. This is about the nerve supply in the forearm. Okay, and nerve supply in the hand we will see in the next video. Okay.